Well, good morning, and I hope you had a wonderful weekend. Welcome into the Real Monica Adams show. We had such a phenomenal week last week talking about medicine, and you probably heard us say that we were going to discuss functional medicine on today's show. We're actually going to bring both of our guests in together and then kind of separate up some of the topics, but really see what does it feel like when you start to introduce functional medicine into your life. I hope you also enjoyed our Just Pools show, getting an opportunity to showcase pools at Just Pools and Spas, which is on the West Outer Road in Arnold. I love the idea of bringing this show to your business. So if you want us to do just that, email me, info@TheRealMonicaAdams.com. We've been doing a lot of these mobile Monicas, and we've been booked every single Thursday since January. Again, it's been absolutely amazing to get the show out to you. And by the way, we were talking about our 400th celebration show, which we think is going to be near the end of September. I'm going to be in Cabo San Lucas, though, I think on the actual 400th day. So do we celebrate in Cabo? That would be kind of cool. And then we come back and we celebrate at one of your businesses. But I'm giving you an ample opportunity to start contacting us and saying, hey, I saw the numbers and they were huge at Just Be Kind Cafe. Marianne was thrilled to have us out there. So how about you? Let us know if you'd like us to have the 400th celebration at your business, or if you know someone who has a business and you would like for us to be at your friends or your family. Start telling them, and we will actually reward you $100 in Monica merchandise, jackets, shirts, journals, coffee mugs, whatever. It's all yours, just to say thanks for allowing us to do the show from your friend's business. All right, it's Monday, so Medical Monday time, and I love that we incorporate health. It's obviously been a big part of my life, and there they are. Ask the Doctors, sponsored by InVita Health and Wellness and Mid-America Spine and Rehab. Dr. Sean Neary and Dr. Sara Franco together. Both of you, thanks for coming in.
Of course, good morning.
Good morning.
You know, we've actually done a show in the past where we talked about traditional medicine versus functional medicine. And I think the very first thing, and it was a huge show, by the way, there were a lot of people going, yeah, I've heard functional medicine. I don't really understand what it is. So if you didn't see that show, let's break it down. First, what is functional medicine, Sara?
So it's really just getting to the root cause of what is causing the condition. So instead of just taking some exogenous medication and throwing it at it, it's getting to the reason why you're experiencing those symptoms or having those ailments.
And see, isn't that an aha moment that wouldn't you think that that's how we should always be treated? And I think that's how traditional medicine should have been. We're looking at functional medicine, the whole person approach, personalized, patient-centered, collaborative, right? And that's kind of why I'm bringing the two of you in together, finding the root causes, as Sara just said, systems biology. So, you know, here's the thing, though, both of you, as people are watching this, they would say, well, gosh, have we been that far off for hundreds and hundreds of years in traditional medicine where we're not, you're both smiling, not thinking about what the root is and just prescribing this medication, that doesn't work, let's do another medication. And I'm going to say this, Sara was in the traditional medicine aspect for 20 years in the ER, and then she opened InVita Health and Wellness and wanted to get really deeper into the functional medicine side. But I mean, I'm not mocking anything, but it's almost laughable to say, why isn't traditional medicine more into the root?
I think people just kind of get set in their ways. Change is hard, and it's really, I mean, it's much easier. It's easier to tell a patient, well, here's a pill for your blood pressure, just take this, than have that real discussion with them. Well, you're overweight, you're not, your activity level is declined and your dietary habits are awful. And, they don't have that kind of time to have those conversations with those patients. So it's just easier just to prescribe a pill.
So we have to change mindset, because I think we've all been pre-programmed from a very young age. We go to the doctor and we are prescribed medication. Mm-hmm. But again, we go into another country and it's so very different of the way you're being treated. And then people come over into our country and go, wait a minute, I want to go back to my country, mm-hmm. right? Again, we're talking about functional medicine at the beginning part of this. We're also going to talk about autoimmune disorders. We're going to talk about plantar fascitis. So a lot to be covered in this hour. But I asked her, so let me ask you, what do you consider functional medicine to be?
What I really liked about that last graphic was the patient-centered mm-hmm. and collaborative. Because if somebody comes in and on the more traditional model, I have diabetes, type 2 diabetes. Okay, what happened? Did the pancreas start to dysfunction and it's not actually producing the insulin? Is your diet just so out of whack? So just those two, when you go to patient-centered, I think you should approach each patient just a little bit differently. Now in the traditional model, they're going to say, here's this medicine, it addresses type 2 diabetes. But in more of my realm, I have low back pain.
Right.
Where did the low back pain come from? We can do an injection right there, but if it's a disc, bone on bone, a shot might help for a little bit, but we're not addressing that root cause of what's causing the low back pain.
Yeah. And again, Zach, by the way, Zach Kimball, he's just absolutely amazing. Thank you for getting all of these slides together for us. So I think a lot of you have asked before, what in the heck is functional medicine? I hear this term thrown around, but I'm so confused. Autoimmune disease, and we're going to talk with Sara about autoimmune disorders and what she can do to help. Cancer, I mean, look, that word that we hate, because we can be sitting in a room of 100 people, and I can guarantee 100 people will all raise their hands and say, I know someone that's been affected by cancer, or I have cancer, right? Hormone imbalance, which we talked about last week. GMOs, emotions, so that's the whole body, right? The stress, the fear, the anger. Sleep disturbance, which Sara and I mentioned last week. Leaky gut. Heart disease, diabetes, how it's affecting all of that. Getting to look at that. That picture is perfect. You look at a tree and what is happening in the roots and how do you take care of it, right? What's the soil? How are you feeding it? All of this is the body itself. So from a functional medicine standpoint, it is treating you in a whole different way. Sara, let's ask this, because there's a lot of people over the last, I'm going to say 10 years, that they used to go to their doctor, their traditional doctor, and then all of a sudden they found that that doctor changed to concierge medicine, which I was like, well, concierge, well, that's like you're at a hotel and they're doing everything for you, right? They're taking care of you, patient-centered. How did that ever come about? Why do you think concierge medicine came about?
I mean, honestly, I think it's probably the physicians getting tired of dealing with the insurance companies and the low reimbursement and not allowing them to do the tests and things like that they feel that the patients are needing in order to make that diagnosis.
And if someone's going to concierge medicine, is that someone that's more sickly? Because I remember a doctor of mine saying, Monica, I'm and this was a traditional doctor that I had, and he's like, I'm actually going to concierge medicine. He's like, I hate for this for you because you don't really need to pay for concierge medicine. But a lot of the doctors went to that. I always wondered why, though. That's interesting. I was always thinking they want to be able to spend more time, which I know we've had a doctor on in the past that said, yeah, I want to get it right. I don't want to be coming in and being like, got to get to the next patient, got to go to the next room, which is kind of the way is that more so?
Well, no, and I think that might be a reason too. But you know, again, now we're kind of getting to root cause. Why are these huge corporations telling physicians, well, you can only spend 6 minutes with each patient?
Yeah.
It's because they have to get that many patients in through the door in order to make the same amount of money that they were making a few years ago. So I think it always comes down to money.
Right? Deep sigh, big breath. If you're just tuning in, it's a Monday, so Medical Monday, taking care of your health, taking care of your body. These two are incredible in their fields. Dr. Sara Franco, InVita Health and Wellness, Dr. Sean Neary with Mid-America Spine and Rehab. And we wanted to bring them in together because it is, I love that word also, Sean, that it's a collaboration, right? It's a handoff to say, and we've mentioned this before. Hey, Monica, I'm seeing these things go on. We can adjust you, but I also want to make sure that you go to an orthopedic doctor or whoever. I need you to go to a traditional doctor. I need you to go over and Sara. I need you to have your labs done. You know, we talked about gut health. Those things all make the whole person, right?
Right. And that's what I love about what we do. We are allowed to spend a little bit more time with the patients.
Yeah.
But that also gives them the opportunity to tell us more about what's going on. Yeah, you came in with low back pain, but I'm really tired. I'm not sleeping. I'm fatigued throughout the day. I notice all these other symptoms. Like, great, we have somebody else for you. Let's co-manage this. We're going to come in with the low back pain, but is the low back pain coming from a leaky gut situation that a functional medicine doctor can address? And then almost said, oh, my low back pain went away. But like we were talking about last week with weight loss, okay, now we're addressing so many other issues. Low back pain goes away.
Well, and this is where the two of them would collaborate so well because, you know, we've talked a lot about semaglutide and more people saying, oh, well, you know, we talk obviously about diabetes and diabetes patients being on Ozempic, et cetera, Wegovy, whatever else is out there. There's so many. But there are opportunities for you to say, well, have you been on a weight loss plan? And then people usually like, oh, yeah, I tried. And then it's like, well, all these things that you're telling me, let me have you call Sara, because we can work hand in hand. We can get some of this weight off of you, and then we can start seeing how it helps your spine and your hips and your knees and everything that's got you out of whack.
Right.
I mean, I'm a big proponent of you getting to the best version of you, because I see that pain go away.
Absolutely. And then also with like an orthopedic surgeon, hey, we're going to work on your hip, your knee, your low back for as long as we possibly can
Before surgery.
Before surgery.
Yeah.
But if we're not making any headway with 6 weeks of active treatment, we have other people to send you to.
Yep.
Let's get some other imaging. Let's see what else is going on in there.
I think the really important thing that he just said about 3 minutes ago is having the opportunity to spend time, so you can actually, that's why you're so big on the consultation, Sara, is for people to sit down and they start opening up, right? Don't you see that in both of your fields, that you start going, oh, well, here's the actual issue.
Right.
It's not what you originally came in for. And as you spend more time with them, you get them to open up and you hear those stories.
Definitely.
Right?
And also they don't even know to approach a certain topic with us. But the more you get to talk to them, spend more time with them, they start, little tidbits of information start coming through that we need to pick up on, and then we address them then. It's not all going to come out in a consultation.
Yeah, how often does that happen with you?
All the time.
Yeah.
All the time. Yeah. Yes.
This is not, well, and like you just said, if somebody had a sleep issue, it could come back to hormonal issues, which we mentioned last week. So if you didn't see that show, by the way, and there were a lot of people that evidently were tuned in, I saw the numbers right as we got off last week, and we were already reaching 1,200 people in an hour, which is beautiful. Thank you, by the way, because that means that all of you are sharing and telling everybody, watch this show. This is affecting you. You're not sleeping well. You're getting, what, 2, 3, 4 hours? How in the world do you think that you mentioned brain fog in the past. How in the world do you think that you can do your job? And I don't know what you all do, but if you're in charge and all these people are like following you, you're the leader, and you're just cranky and yelling at them, and they're like, what the heck's wrong with this person?
Right.
It's all leading to the root of the fact that I didn't sleep well. My hormones are off. A woman dealing with hot flashes, which, by the way, thank you, because once she got my labs done and got me in order, I was like, oh, so I didn't have to suffer through this. All of you ladies that think menopause, you hear, because we did, Sara, when we were young. Oh, wait till perimenopause. Wait till menopause happens. You have to go through hot flashes, and you don't.
No, not at all.
So there were years that I slept with that until I met Sara, my angel.
That's actually really good to know, because that people open up to me about that too. Hey, I'm not sleeping well. Like, okay, are you twisted up or what's going on? Like, no, hot flashes. So
There's your,
learned
I always got to
something
chill.
new, too.
Yay! There's the collaboration.
Right.
Yes, now you understand. We shouldn't have to. I don't think I've ever asked you, do men? Because I know there are some type of experiences that guys go through. Do they, if their hormones are off, do they have hot flashes?
They don't, not generally. No,
No.
not
See,
hot
you
flashes.
guys,
No.
I'm telling you, it's a man's
Sometimes we're
hormone.
lucky.
But they do experience some things that women have gone through. We haven't done this story, by the way, I don't think, on a Monday, but there are men who actually have breast cancer, correct?
Yes.
Yep. I think that's a ding ding. I remember hearing about that years ago, and I was like, didn't know that.
Yeah.
Again, there are specific things that we think are only women centered and only men centered.
Right.
And that's the aha moment, which is, we talked before about the fact that women never thought that we had to know what our testosterone numbers were.
Right, and it's kind of amazing how many people, will have their labs checked, and I'm like, well, if you have them, then just bring them in and we'll take a look at them. And so many people will not check women's testosterone, and I mean that's a major functioning hormone in our body, and not quite as much as for a man,
Right.
But I mean it does play a huge role. Hormones are chemical signals, basically telling all of our organs what to do. So
Yeah.
if any of those are out of whack, then it's going to kind of throw off the entire system.
So why do you think, and are there some insurance companies that don't cover it?
I don't think the issue is with insurance. I think it's just kind of accepted that women are progesterone and estrogen and men are testosterone, and it isn't that way.
Right. We were always taught.
That's what we were taught. Yeah.
Testosterone actually does play a pretty big role in a women's health and women's health as well.
Yes, by the way, let's just stress this. And I'm just going to make the both of them laugh. My husband was very happy once she got my testosterone in order. And wink, wink, you know what I mean?
Yes.
So, hey, turn red.
Oh, this?
Yeah.
Talk about hot flashes.
But it's true, all of you. And when we mention bringing relationships back together, it is. Don't you want to have a better relationship with your spouse, with your partner, whoever? If your labs are off, that's it. It goes back to, and my OBGYN used to ask that, Sara. He would be like, well, so how's your libido? And I'll be like, fine. I thought, but it's because I was rush, so busy, and that's how our lives are, right? And it's like, well, I think this is how it is, and I'm older. Is this how I'm supposed to be? No.
That's always everyone's excuse. Well,
Yep.
I mean, I'm older. Well,
Yep.
I'm older. Well, you're not dead though. So I mean, so live your best life until you are dead, you know. But the whole, you know, well, I just have to deal with this because I'm getting older. It isn't that way. You do not have to. You do not have your quality of life does not have to suffer.
There you go. I mean, drop the mic on that quality of life. And that is really what we're trying to do. Every Monday on this show is for you to understand there's so much more for you than what you're walking around at. There's so many zombies. It's what it looks like. Everybody's angry at each other. They're a hate-filled world. I just think there's a lot of people off. And it might a lot have to do with hormones or pain. Right. This is why we brought the two of them together. I'm going to take a quick break. Again, it's Medical Monday, our Ask the Doctor segment, functional medicine. And I'm going to break it up a little bit here. We're going to talk about autoimmune disease. We're going to talk about plantar fasciitis. Woo, that's painful.
That's a big one.
We'll have more with the two of them when we return. InVita Health and Wellness, where you can feel your best both inside and out. InVita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, InVita can ensure that their advanced treatments are provided safely with minimal to no pain. So let InVita take care of you. Call 314-394-0950 to book an appointment or online InVitaHealthAndWellness.com. Welcome back, and thank you again for being a part of the Real Monica Adams Show. We brought the doctors together this morning, and I really like when we do this, getting different viewpoints and then very similar viewpoints. These two are very into functional medicine, the root cause of your problem, not masking the pain, not trying this medication, that doesn't work, another medication. And my problem with that, being in the health and wellness industry for almost 30 years now, has always been that you bring that to me as your trainer and your life coach, and it's like, why are you on all of this? And they don't even know. They have no clue. This one is to counteract this one, and this one does, and oh, this one's causing this problem. And then you hear the laundry list of side effects that just should scare you. And it frustrates me because there's so many of you that have kids that are going into the health industry. I hope that somebody is able to start finding medicine that doesn't have that, that literally this is great for you and there aren't no side effects. I mean, don't we want that?
Absolutely.
This could kill you. But that's okay.
Yeah, right.
No, we want you, as Sara said before the break, to have quality of life. So autoimmune disorders, first of all, what is an autoimmune disorder? And then we're going to talk about what you can do for them.
So our immune system it's there to protect us. So anytime it recognizes something as foreign or something as off, then it's going to kind of have this over-exaggerated response in order to try to get the body back to homeostasis. So there's a variety of conditions that come about with that.
And again, we're looking at autoimmune. So if somebody has an autoimmune disorder, I mean, we're looking on the inside of the body, but we also saw pain, inflammation, which you and I have talked about in the past. Is that a genetic thing?
I mean, it can be. It can be. And a lot of it, I personally, this is my complete unsubstantiated theory, though, is kind of geographical location too. Here in the Lead Belt, we have one of the highest incidences of multiple sclerosis, as well as a variety of different thyroid conditions, both hyperthyroid and hypothyroid, which are both autoimmune conditions too. Psoriasis is huge in this area. So I think a lot of it, there's the whole nature, nurture, environmental, what we're eating, everything is going to play into that.
Interesting. Well, I've heard in the past, and you all need to look into this, by the way. I remember doing a story years ago about, you're talking about geography, about the area where young kids live and how it plays into autism, ADHD, all of that. I mean, it's shocking if you really dig deep. It's what are we doing to ourselves? And then what are we eating? Where are we living, etc. So if someone does have an autoimmune disorder, what are they feeling? What are the symptoms to find out that they even have this before they ever go to the doctor to say, oh, well, maybe that's what I'm experiencing?
Well, it's going to depend on, what the condition
disorder?
is. So if it's something like a thyroid disorder, then they're probably going to have some heat or cold intolerance, some weight gain. They may even have, some swelling in the neck, a goiter, anything like that. If it's, rheumatoid arthritis, then, it's going to be the joint pain that you're talking about. If it's Crohn's disease, then it's going to be GI symptoms. So it really kind of depends on what the autoimmune disease is.
So if somebody does have an autoimmune disease and they want to come to you, what are the things that you can do to help them?
So we can do testing and see what the autoimmune disease is, and then just kind of look at what aggravating factors are. For instance, I have Hashimoto's thyroiditis. That is inflammation. It's literally inflammation of the thyroid. So I'm going to have to take something to supplement my thyroid. So my pituitary keeps sending out TSH, trying to get my thyroid to make T3 and T4, and it's just not functioning properly. But it's thyroiditis, meaning inflammation. So if I can decrease inflammation in my body, then it's going to just make my thyroid work better. Probably still not work the way it needs to work without any medication, but definitely work better. So you can either take an aspirin, or you can eat medication, not eat medication, but eat foods that you can either eat medication, or you can eat foods that are going to decrease the inflammation. So, avoiding things that are have inflammatory components to them, or eat things that are anti-inflammatories.
How often, though, in the medical industry is someone as a patient told, all of these things could be better if you eat this way? And they go, yeah, forget it. I'll just deal with the pain,
Right.
which doesn't make any sense.
Right.
Until it gets worse and worse. And then they finally go, I was told that 10 years ago,
Exactly.
20 years ago.
Right.
Right. Men are, by the way, I'm not male bashing, but you're a little bit more stubborn.
Yes, we are. I think we've,
Okay,
I think
good.
we've
You're
used
gonna
that
admit it.
exact phrase before. Men are stubborn.
Yes.
Because back to the inflammatory aspect, one of my first things that I'll talk to a patient about is, let's go on an anti-inflammatory diet. So exactly, eat less sugar, the less grains. We're not inflaming the body as much. Oh, that took care of some of my pain. Great, we're on the right track.
Right?
Yeah.
Well, we've talked about gut health before. I mean, there's so many things that would go back to gut health that if you get that in order, there's a lot of pain that you wouldn't be experiencing. There's a lot of these other issues internally that you wouldn't be experiencing. But people say, well, then okay, let's just ask that. How do I take care of gut health? What do I need to do?
Well, you need to identify foods that do not
Sit well with you?
Sit well with you, exactly. I mean, a lot of patients think that if they don't have an allergy to the food, if they don't break out, or if it doesn't cause diarrhea or something like that, then their body isn't responding to it, and that is not the case at all. So a lot of times that's gonna, there are some allergy testing that we can do, or sensitivity testing that we can do, but you can also do kind of exclusion diets as well. And if you don't believe it, because it honestly, it took me until my triplet before I was like, okay, maybe there's more to this milk, the devil juice. Before I bought into it, I mean, really, try cutting out gluten for 1 week of your life, and just see how much better you feel. If you can do it, and you can, cut out sugar for a month. And I mean, you go through, you kind of crash and burn a little bit, but then by the end of the month, you feel like a completely different person. You're basically just detoxifying your body.
Okay, and I'm going to say this is the disclaimer immediately. I have nothing to gain from this, but I'm going to tell you something that I love. They really do need to team up with me and give me some money for this. The Ultimate Reset. Look it up. And there's probably a lot of, how about this? Just look into a good dietitian or nutritionist that can help you, and they will start to break things down and help you with some of this. But there's something called the Ultimate Reset. I used to be a Beachbody coach, and a lot of people know about Tony Horton and P90X and Shakeology and all these things I still love, by the way. But the Ultimate Reset, which was put together by Melissa Costello, a phenomenal chef, I've done that with so many of my clients. I would almost say you could do it maybe a couple times a year. Some people would do it like with the change of the season. They would do it once a quarter. It is phenomenal. And here's what it has you do, just like Sara was mentioning. You will start to pull out, first of all, you'll pull out animal products. Not that they're trying to push you to eat vegan, but they're showing what animal proteins and the strain that it does on our bodies. And also, though, as you start to reintroduce one at a time, The problem is people will be like, let's just put it all back together, and then you don't know what the cause of the problem is, right? We're talking about functional medicine and root of problems. This will allow you to do that. So you pull out dairy, you pull out eggs. In the very beginning, you have like a chicken breast with a salad, you have some eggs, but then after probably 5 days in, you pull that out. So for like week 2 and week 3, you do this for at least 3 weeks. You start to reintroduce into that third week. It's a wake-up call. It's an aha of, oh, I do feel a little bit different, but you won't know those things until you'll introduce for a few days. And the body's okay. Okay, well now we can I think they reintroduce eggs first. Well, now we can reintroduce maybe Greek yogurt, and we can introduce fish. And then if people want to go back and introduce chicken and meat, red meat, things like that, you can. But that's where you start to go, and for me to give you this experience, for me, I was able to find out that my body does not like chickpeas. I've told you before, hummus. I thought I used to, but so if you're wondering, well, what does it feel like to have a problem with gut health? You just bloat, right? And then your intestines, your digestive tract is all not working properly. Right. So will I be able to have hummus here and there? Yes. As Sarah's saying, I'm not breaking out and getting hives, and you're like, I got to rush me to the hospital. But I know I'm not going to feel good. Okay, I'll have a little bit of it, and you deal with it. We deal with things, which doesn't make sense, right?
Oh, yeah. Back to the milk. I don't know your story, but when I have...
It's a good one.
I'm sure. With we talked about the pregnancy a couple weeks ago.
Yes.
With new moms, my baby is not sleeping. They are colicky. They're not going to the bathroom. I go, okay, we're going to address your diet because that baby is getting what you're doing.
Yes.
So we're going to cut out dairy first. Dairy is usually my first go-to, and then eggs.
Do you want to tell them the story?
Sure. So one of my triplets was so I have 2 girls and a boy. The boy was just behaving badly. I mean, luckily my husband and I kind of waxed and waned on losing our mind with him, but he was being aggressive toward his sisters. He was just crying and just not inconsolable, but he just was not pleasant to be around. And I was complaining about this to one of my patients, and she was like, does he drink cow's milk? And I said, he does. And she goes, cut that out and it'll all go away. And I mean, I joked with Monica, I'm like, at that point I would have smeared him with peanut butter if it would have meant him not crying all the time. So we cut out cow's milk, we went and got almond milk, and 3 days later, completely different kid. But so much so that he went back to school and like a couple weeks in starts acting terrible again. And I'm like, did somebody give him milk? And my husband's like, he doesn't even eat lunch at school. I go and pick him up. Nobody's giving him milk. Well, he went and dropped something off that day and took a picture of Julian sitting there with his little goldfish crackers and his little carton of milk for snack time. And I was like, I knew it. So, but he even tells my mom, he was like, Nanny, I can't drink that. That's devil juice. And I was like, okay. Well, so we're all organic milk at our house. But I did fine with milk. The 2 girls did fine with milk. But the hormones that were just in good old vitamin D milk, his little body just could not process it.
And it's such a common story that we hear about.
Yep.
It's just such a wake-up call. I mean, I want you all to go, holy cow, is there something in your refrigerator right now that's causing all these symptoms or affecting how your behavior is? It really goes back to our food and the things that we allow. And it just scares me sometimes to think where we're going to be in the next 5 years and 10 years. And if we look 10, 20, 30 years ago, all these things were not injected into our food.
And it makes my heart hurt a little bit because I wonder how many kids are diagnosed with like learning disabilities or ADD or ADHD. Yep. Where are we going to be in 10 years? We're all going to be on Adderall and Ritalin because they're going to think everyone has attention deficit disorder. And I think a lot of it is just our bodies do not know how to process the foods that we're taking in.
Well, and again, I've said this before, and I like the fact that we're bringing some of these familiar topics back up. But my very first author interview I ever did 30 years ago was Right Brain Children in the Left Brain World. Too many people are so quick to put their children on medication because they are labeled ADD, ADHD, and I mentioned depending on a lower level of the spectrum from autism, and you have to look a little bit deeper before you just throw them on medicine. I mean, we're in a world where it's just, here, give medicine, shut them up, get the kid out of my way. They're driving me insane. Instead of digging deeper to the root of the problem, which I'm not shaming any of you parents, but I'm not a parent, but I would tell you that that's what I would do. What are we doing wrong? What are we feeding them? Can we change their little diets? Right? They don't want to be running around crazy, making mom and dad mad. They don't know what's wrong with them.
Right.
Right? So all of these issues. Functional medicine, I can't stress this enough. One of the things we also wanted to discuss is plantar fasciitis. So we're going to go into that. We mentioned inflammation. We mentioned pain. It is one of the most painful things, from what I'm told. Thankfully, I've never had it, and I hope I never do. I've had like stone bruises and things like that hurt, but this is magnified 10 times that. So we're going to talk about that when we return. Again, Dr. Sean Neary, Dr. Sara Franco. If you have not been in to see my friends, I want you to do so. InVita Health and Wellness.com, 314-394-0950, located in Kirkwood. There's the website and the phone number. And then Mid-America Spine and Rehab at 1030 Old DePere Road. StayWellSTL.com and 314-966-8989. Rolodex.
Good job.
Thank
That
you.
was impressive.
All right, more with Sara and Sean when we return.
She's a special woman and done so much for St. Louis.
Watching her work is one of the most incredible things you can see.
She just sees value in everyone.
Sometimes people just need you to sit with them and hear them. I feel heard.
The time flew by, and it was like sitting and talking to a friend.
Not only creating a better place here in St. Louis, but to inspire others. It's always great to have examples like you.
You have such a light and such a presence, and I could feel it this morning.
We knew right away when you started this, we wanted to be on your show. Thanks for having us.
I look forward to seeing how you rock and roll and shake it up.
Welcome back, and it is Monday, Medical Monday, our Ask the Doctor segment, and I always love when I bring them together because, again, we hear a lot of similar viewpoints, maybe a little different. It's a good thing, by the way, if we don't all agree on things. We're not a world of everybody that are the same mindset, but with these two, from a functional medicine standpoint, this time absolutely on the same page and a lot of great collaboration. We did this in the past where we were talking traditional versus functional medicine. It was a really popular show, so I wanted to bring these two together. Sara came from a traditional medicine background and said, look, I really see more and more need for functional medicine, which is why she opened up InVita Health and Wellness. And by the way, if you've been lately, it's really popular because there's a lot of people going there. As I come into your room, I'm like, holy cow, there's people everywhere. It's exciting to see the growth that has taken place over the last year. I want the same for my friend Sean, Dr. Sean Neary with Mid-America Spine and Rehab. And if you are walking around and you're just in a state of pain, inflammation, gut problems, autoimmune we talked about, any aspect from head to toe where you feel off, well, here's an opportunity for you to take care of your body inside and out. We mentioned, yes, you are accepting new chiropractic patients. I took that picture when I first went in. I was like, that's happy. I'm happy because he took me in gym.
Right.
So yes, I want you to go in and make sure that you're feeling your best. How many people come to you for plantar fasciitis?
Oh, we have probably 5-10 a day.
A day?
Oh, it's one of the common condition that we see.
Wow.
But again, coming from a chiropractic perspective, people don't even know to address that with us. My back hurts. It's low back and neck pain. It's like, no, it's the body that
it's starting from here.
It's starting from the foot, and like we were talking about last week, the foot to the knee, to the hip, to the low back. Where does it start? Where do we have to start addressing the root cause?
Should we all start singing the song? The knee bones connected to the... Okay, so plantar fasciitis, what is it?
So plantar fasciitis, just like we've been talking with any itis, it's inflammation of the plantar fascia. Okay. So the plantar fascia, if we know what fascia is, it's encompassing all of the muscles, and there's no start point or end point. It's wrapping around everything. When we get to the bottom of the foot, the plantar aspect of the foot, it becomes this very thick band, and it's inflammation of that band. So anytime you are stopping or stepping down, your feet flatten out a little bit just through the natural gait cycle, putting stress on that plantar fascia. Now, when we start to feel pain on our heel bone, that's our typical first sign of plantar fasciitis. then it can spread all the way down into the midfoot to the forefoot.
And again, you see all that red. That's pain. That's inflammation. That's not good. That is not what we want you to be feeling. So if someone has flat feet, just they were born that way, are they pretty much, they're going to expect to have to deal with this?
They're more prone to it.
Okay.
It's not a foregone conclusion that it's going to happen, but it is a common thing. We're going to look at the arch of your foot. I have plantar fasciitis. Well, let's see how flat your foot is.
Yes.
And if we need to introduce an arch support into there, get the bone into that more natural position that it's supposed to be in.
And by the way, I will share this story. When I was a young little girl, I don't remember how old I was, but my mom took me to the doctor because she was like, Monica's feet were flat, which you can see now I do not have flat feet because I was taken in at a very early age and they would watch my gait, watch me walk, and we were able to change that. I think there's a lot of people that think, oh, I have flat feet, I'm going to be stuck with flat feet. That's not the case.
Not at all. No, we deal with several different orthotic companies for inserts in your foot, and it helps give you that support. No, it's not, you don't have to deal with flat feet forever. And if we can address it at a younger age, much more success.
So if somebody has this, and again, it's painful, one of the worst things that they do is say, well, whatever, I'm just going to deal with it, and I'm going to keep doing the same exercise or walking.
Yep.
Is it rest that's needed?
It is rest, unfortunately.
We're in a world of go, go, go.
Yep. Rest and ice. Because
for how long?
Till we get the symptoms under control.
So how long does that usually take?
Usually 2 to 4 weeks.
Woo, yeah. And you want them to just rest.
Right, but then we have people come in and say, I've had plantar fasciitis for 6 months. You're not supposed to have it for 6 months. It is a condition that can occur, but getting that inflammation down, 2 weeks is our typical turnaround.
Yeah.
But we also use, the cold laser and the infrared and ultrasound to help, with the symptoms.
That's what I was going to ask you, because I did an interview with a doctor 15, 20 years ago, and he started talking about how they were doing ultrasound work.
Yeah.
That's still used regularly?
Oh, we use it every day, multiple times a day. When we have we've talked about the red and the white fibers, red being muscles, white being tendons and ligaments. When we get tearing and inflammation in that plantar fascia, we need to make sure it repairs correctly. And that's where those passive therapies come into play.
So if we talked about the root issue of this, what would it be?
Again, flat feet.
But if they didn't have flat feet, what else would it be?
Overuse is a big one. So you talked about the bone bruise. That can be the start of it also, a bone bruise. So luckily you didn't progress into this.
Why is it called a stone bruise, by the way? Do you know?
I have no idea.
Yeah.
No.
I used to hear that. I'm like, I didn't step on one.
Maybe that's where it came from. They used to step on stones.
And that, I don't know. If you all know, you can let us know. Okay, so let's talk about, did you ever treat anybody who had plantar fasciitis?
I have not.
No? So if someone has that, we mentioned last week that you were going to dispel some rumors out there of what can be done to take care of it. It used to be people would hear to roll their foot on a tennis ball.
Roll your foot on a tennis ball. What that is doing is just stretching that plantar fascia, making those little micro tears worse and worse. Another common thing that you see, and if you Google, don't Google.
Don't WebMD and don't Google.
If you Google treatments for plantar fascia, they have this strap. It wraps around the foot up to the ankle, and you wear it at night, and it pulls your foot up. It's doing the same thing. It's actually making it worse. So we have patients who come in who've been using that for months, and they go, it's not getting better. Like, take that off. Try it for a week. They come back and say, it's so much better.
So it's just gadgets that people are using to sell.
Yes.
And people are believing it. They're up at 1 o'clock in the morning in pain, and they're seeing these infomercials.
Yep.
Wonderful.
But the common things to look out for also is pain first thing in the morning. But again, chicken or the egg, are you wearing that strap throughout the day and you're getting up making it worse? Or if you're feeling pain in your heel first thing in the morning, that's a pretty big indicator that it's the start of plantar fasciitis.
I can't tell. You said you see 5 to 10 a day. I can't tell you how many. I don't even know. I've had hundreds and thousands of people that I have trained over the years, and I couldn't even begin to tell you what the percentages of people that have suffered with that. They want to get right back to their exercise, right? They don't want to sit and be on the sidelines, and they are itching to get right back into it. So they'll try to do the rolling of the tennis ball. They're doing everything that they can on their own. So if they are able to get to it early, you are doing several things. I mean, first you're trying to figure out how long they've had it.
Figure out how long they've had it. There's 26 bones in each of our feet. Is your arch falling down?
Mm-hmm.
Is that causing it? Is your ankle not properly mobile?
Mm-hmm.
So those could all be causes. Is it coming from the calf muscle? Because this fascia starts on the bottom of the foot and goes up and wraps around the gastroc and soleus. So if we're having tight muscles and that fascia is being pulled up, it could be coming from the calf. What's the root cause? Where is it coming from? So if it's muscle causing it, we have a different approach. If it's a bone out of place type of situation, a different approach. Is it actual inflammation that started in the fascia, then affecting the calf muscles?
Interesting. I have a friend who I used to personal train with, and they were just in Naples, Florida a week ago. And my husband's like, that's his problem. He shouldn't have been playing racquetball on vacation. He pulled his calf and he's in extreme pain. Mm-hmm. But you wonder, were there warning signs? Right? You're going to agree with it, right?
I agree.
Jamie, you need to go see Sean.
We'll confirm that. But then again, with pulled muscles, especially the calf, the thing that we think is best is to stretch it out.
Yeah.
But it's pulled.
He may have even torn it. Is
ruptured.
Yeah.
Yikes.
Which I have two friends now that have done that.
Yeah.
Again, but the thing is, and I think they both would agree, if you really get a chance to sit down, which is why the functional medicine aspect of life is more where you can sit and address and talk and find out these things, that it's not that it just happened. It is, there were warning signs. Haven't you seen that a lot in your career?
My big question is why? I have back pain. Why? Mm-hmm. Well, because my bed is, because of the way I sleep. How do you, why? Why are you not sleeping? Oh, because I toss and turn all night. Why? Oh, because you have a hormone imbalance. I mean, if you keep asking why, eventually you're going to get to the root cause.
You just got to keep asking, because they don't usually offer it up, right?
They don't. That's why we have the history and consultation as our first appointment. We're going to go through your medical history.
Yeah.
Was there something did you fall out of a tree when you were 12?
Yeah.
Did you?
Oh, I forgot about that
right?
one.
Were you in a car accident when you were 20?
Yep.
Yeah, you may have been out of pain and not felt any symptoms for the last 10 years, but there was something wrong there.
Right. Yeah. Well, and the thing that I love also is the evolution of medicine. So you both could look at when you decided to go to school and you started, and then look at where we are now and where in the world we're going, which is a beautiful thing. I talked about some things that are scary in our world, but I'm excited that more traditional doctors are opening their mindset to collaboration. I like that. There are still some, and you mentioned at the very beginning of the show that people don't like change, but we really need to jump on board change. Otherwise, we're going to be stuck in the past, and people are going to be like, well, forget it. I'm going to doctors that are more open to this, that open their practice to saying, no, I'm very big on you doing that. I mean, again, there are some doctors who say, well, I don't know. Why would you need it? No, I don't know. I mean, I have talked many times on the show about turmeric and what it does, and it's fascinating. Mm-hmm. Apple cider vinegar, cayenne pepper, all these things. There are a lot of doctors out there that'll be like, that doesn't help. Okay, well, I think it does.
I think it does. I think there's a lot of tests that have been done and studies that have been done that prove that. And this is one of the first things that we talked about at the Working Women show was turmeric.
Yep.
You asked me, what do you think of turmeric? I go, it's fantastic. You're like, all right, this is going to work out.
Exactly.
I put it on my face every morning. So
yeah. All of you, if you're not using it right now, look into it. Doctors that don't agree with me, that's fine. That's what I said. I welcome, we welcome discussion, not bashing each other, but welcome discussion. If someone feels that it does, great. It's not hurting them. If you're thinking, well, why are they spending the money? I don't know. There's a lot of wonderful teas that are out there also that are helpful. Everything that is getting us back to this is how we're supposed to be feeling. And that's what both of them would want. Before we wrap up, with regards to the inflammation aspect and everything, for you, are there things that you do? And I'm wondering, because you do a lot of IV hydration therapy, does that help with inflammation in the body?
Well, we do a lot. Replacing a lot of those vitamins and things like that are going to help with inflammation.
Yeah. Electrolytes and stuff.
Ketamine helps with inflammation. High dose vitamin C helps with inflammation. So there are a variety of things that we can do.
Right. So there's the collaborative effort. That is why I wanted the two of them to come together today. So again, we talked about a lot of things. If you are just tuning into the show, do me a favor and go back to the beginning. We talked about autoimmune. We talked about plantar fasciitis. We talked about inflammation. We talked about the geography of where you live, and then really the root cause of problems, all going back to functional medicine. And we could talk about functional medicine literally every week, and something new would come up, because even though it's been around for a long time, there are a lot of you that are still like, Is that a new thing? Did that just come about like yesterday? No, the answer is no. But there will be more evolution of functional medicine. So with all the things that we discussed today, what are you feeling in our 100 Days to Freedom? Let's see if you two, can you two just agree on a color? Well,
I was going to say orange.
oh,
Crazy.
look at you
Is it
two.
a chill moment?
We haven't
Yeah, right.
done this one. See what happens when you bring the doctors together? Okay, so it's depression, by the way. 100 Days to Freedom from Depression. That's what we will do as we wrap up our Medical Monday when we return. InVita Health and Wellness, where you can feel your best both inside and out. InVita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, InVita can ensure that their advanced treatments are provided safely with minimal to no pain. So let InVita take care of you. Call 314-394-0950 to book an appointment or online InVitaHealthAndWellness.com. Welcome back. I hope you have enjoyed our Medical Monday segment. We always wrap up with 100 Days to Freedom when I'm on set. These are the Stephen Arterburn books, and it's a daily devotional. This one is from depression, and it's day 20 of 100 days. This one is called God Keeps You. To him who is able to keep you from stumbling and to present you before his glorious presence without fault and with great joy. So, this is crazy that you two picked this one. You ready? The opening line says, when we go to the doctor's office, of course, take tests, and then we wait for results. Regardless of the outcome, we know that we will move forward into uncharted waters. God's people consistently walked into unknown. In Exodus, we read about God delivering the Hebrew people of Egypt through Moses. It was an answer to prayer. And they realized they were being pursued by Pharaoh to the edge of the sea. Then God stepped in and parted the waters. That's Deuteronomy 29, verse 5, by the way, stating that after 40 years on the journey, the Israelites' shoes and clothes did not wear out. Later, when Joshua prayed, asking God to give the army more light so they could see and destroy the enemy, God stopped the sun in the sky. That's Joshua 10, verse 14, saying, there has never been a day like it before or since, a day when the Lord listened to a human being. Surely the Lord was fighting for Israel. God's people stepped out in faith, not knowing what was coming next. And each time, God showed his power by providing everything they needed. And God does the same for us. We might not know what an ailment will bring, but we do know a God who is with us for the journey, no matter what happens along the way. Well, Philip Yancey says, a God wise enough to create me and the world I live in is wise enough to watch out for me. That's a good one. J.J. Packer said, there is unspeakable comfort in knowing that God is constantly taking knowledge of me in love and watching over me for my good. And Charles Stanley, wherever you go, God is with you, watching over you, protecting you, and providing the truth you need for every situation. But the question is, will you actually be open to it? Will you open your heart to it? Word, apply it to your life and allow God to change you so that he can use you in ways for greater than you could ever imagine. So today's prayer, Father, my circumstances are uncertain. I do not have a clear direction, but I thank you that you already see the next steps and the outcome that we can't see. Help me to find peace as I step out in faith. We say that a lot, right? We have to have faith. In Jesus' name, amen. Good one. That's just crazy that it was doctor related. It's so eerie. You're so funny. Both of you, thank you. I love having both of you together. I appreciate everything that you do. And thank you for your knowledge. And to all of you, thank you. Again, Dr. Sara Franco, InVita Health and Wellness, Dr. Sean Neary, Mid-America Spine and Rehab. Please seek them out so that you can be the best version of yourself. And as we said at the very beginning of the show, quality of life. All right, go out, enjoy the day, and remember to spread the love of kindness. Have a great one.